who are pediatric dentists, they are part-time tooth fixers and full-time toy distributors. They don't just fight cavities. They negotiate with dinosaurs, the ones who are kicking, screaming, shouting, and the princes who are like divas who walk into your clinics, and superheroes daily. What is the drill that you follow? The drill is on bubblegum flavored bravery. You have to keep a smiling face all the time. And the last one, which I think everybody will associate with, is our patients don't forget their first feeling, and neither do their parents forget the wallet which has been emptied. So with that, I would like to introduce this eminent panel. Dr. Vishwas Saugule, the senior most amongst all of them, Nupur and Dr. Haridas.
Thank you, ma'am.
With this, we'll start with the questions that sort of run through our OPDs every day. And the first one, I think, will go to Omkar. And I would like you to tell us what is delayed eruption of teeth and how does one deal with the common questions that mothers ask, the teeth have not erupted.
Good morning, everybody. So let's understand when we call it delayed. So generally 6 months to 9 months is the age where first tooth in your oral cavity erupts. But all these data, they are based on European or those children. So with our experience, we have understood in Indian children, till the age 1 year, like 6 months to 1 year, is the appropriate age where first tooth can erupt. Even if it is not erupted till first year of age, we consider it as normal. So even you can tell them, it's okay, you do not need to worry that 1 year is okay. After that, 12 to 15 months, we should start diagnosing or we should start investigating at least why it is not erupting. We can start with X-rays first of all, and if there are no teeth, we must see teeth on X-rays at that age. If they are not present, then we can immediately start interfering and giving some treatment. But even if the teeth are present inside the oral cavity or the jaws, we can still wait till 18 months. But after 18 months, yeah, it is obviously a delayed eruption. And then we also send it to pediatricians only to find out some systemic cause or some hormonal changes like hypothyroidism or to consider some syndromes.
So bottom line, not to worry and start investigating after 18 months.
After at least 15 months at least.
Perfect.
Yeah.
The next one would go to Nupur. We generally have a lot of questions coming regarding teething, the myths surrounding teething. So how do you crack that code?
Okay, so thank you for the question, ma'am. The commonest myths which are usually associated with teething are that of fever and diarrhea. But it should always be remembered that the only symptoms which are associated with teething and which are normal are excessive drooling of saliva, irritability, and the child is usually fussy and tries to put anything and everything in the mouth, and that leads to diarrhea. So fever which is greater than 101 degrees Fahrenheit is not because of teething and should be evaluated by the pediatricians, by you all, for other causes, and it is not because of teething. So these are the basic myths which are associated with teething. And the remedies for teething, if you say we can give the child teething rings which are of good quality plastic or silicone, those can be kept in the freezer, those can be frozen, or a homemade remedy which can be given is if the child is put on solids, you can give fruits or vegetables which are completely frozen. Ask the child to nibble completely on it, which can be a relieving effect for the overall gums for the child. So there is no proven literature, there is no guideline according to AAPD, there is no guideline mentioned anywhere about Dentonic, that Dentonic relieves dental pain. So it can just be used as a placebo, but otherwise it's not recommended by us. For the parents. The placebo for the parents, yes.
Are people using still?
They are.
They are using it still, yes. Thank you.
What about the nettle tooth? We often face nettle tooth. and what to tell the patient, what to do about the tooth.
So natal and neonatal teeth are the teeth which are present in the newborn. So natal tooth is present when when the child is immediately born, and neonatal teeth are erupted within 1 month after the child is born. So the question arises, is extraction always the preference treatment modality for these teeth? So I would rather say no, because in most of the cases these teeth are the deciduous teeth, or these teeth are the primary dentition. So if we decide on getting the tooth extracted, the parent should be counseled that the child will not be having any teeth in the mouth till the permanent tooth erupts in that particular area, which is going to be at the age of 6 to 7 years of age. Extraction should only be carried out if the tooth is extremely loose because there is a risk of aspiration, or if the mother is having any difficulty related to feeding, or if there is a sharp edge on the tooth and the child is having lacerations on the ventral surface of the tongue, which can lead to rigafate disease.
How
So,
many time you come across the extraction of?
extractions very few, sir. So most of the time we go for conservative management.
And one
itself.
message is that it is associated with some syndromes. So for a pediatrician, the message is that the syndrome has to be ruled out. There is some syndrome called as CRIS1. Then there is one or two syndromes which will have natal tooth.
Natal teeth. Yes. Yes. Thank you, sir.
Coming to next to care of the milk teeth. When the care should start and how caries can be prevented, can you elaborate on that?
So, this is the basic, like, dentistry depends on dental caries. So this is the most important question I feel, because more than 50% of the population on this earth has suffered or is suffering from dental caries. We will not hope ki may suffer, but yeah, it is going to happen because we have 32 teeth and it is really impossible to clean everywhere inside your mouth. So so let's understand caries first, and then we'll come to how to keep it clean. Caries is basically a triad of microbes, microorganisms, plus carbohydrates, plus enough time. So microorganisms are present inside your mouth. You cannot avoid that. You have to eat your food which contains carbohydrates. You cannot separate carbohydrates from your food. So even that thing is not in your control. So the only thing which is in your control is time. So microorganisms plus carbohydrates, if they stay more than few hours on your teeth, then only cavities or dental decay or dental caries may start. So what you can do is, you can eat whatever you want, but just clean your tooth as soon as possible. It forms the microbes whenever they get carbohydrates, and whenever they get a good place to hide on your tooth, they will form a microfilm, they will form a biofilm which is called as dental plaque, which takes around 24 hours to 48 hours to form. And after that, if it is not disrupted by your brush, then it will form a dental decay or a cavity. So this is basic. So you can brush as soon as possible when you eat, when you have some carbohydrate incoming in your oral cavity, and you can stay free of caries. Now, in case of children, you have to start your oral care as soon as they're born, because it is not only teeth but tongue also contains many microbes. Whenever food is stuck on your tongue, you have to clean that tongue, and because that is the main area where you have halitosis if there is a food or microorganisms on your tongue. So you have to clean your tongue as soon as you feed the baby, whenever possible. And basically there is a habit in children, like they feed and they sleep like that only. So without cleaning your mouth, that is the most common cause of caries in children. Milk is not bad. Milk, you have to give milk, but you have to clean your tooth. So as soon as possible, the first tooth erupts, you have to start cleaning that tooth, and before that you have to clean your gum pads, you have to clean your tongue daily.
Perfect. So the bottom line is that, all babies who come to your clinic, whether they are breastfed or they are fed,
Oral cavity should be clean.
should be taken care of. Okay, so the next question is, which is a favorite of all the parents who visit us. Which toothbrush should I use? Which toothpaste is the best for my baby? And like most of them don't know how to brush. It's like brushing the floors of the room or painting the wall. So how do we explain that to the patients? What is the best technique?
So honestly speaking, there is no best toothbrush, there is no best toothpaste. Just emphasize on brushing twice a day with any soft bristle toothbrush and any toothpaste which is preferred by the child, be it any flavor, be it any color, whichever is preferred by the child. Just make sure the child is brushing for 2 to 3 minutes in the morning, 2 to 3 minutes just before going to bed, and not to have anything, be it feeding, be it eating, anything after he brushes at night. And secondly, it also should be emphasized that the gum patch should be clean even after the first tooth is erupted into the oral cavity. That can be done with a soft bristle finger toothbrush or with the help of moist gauze pieces, so that there is no remnants of feeding milk which is there on the gum pads, and which will be cavity preventive agents for the cavity.
Perfect, that's a good enough answer.
What about the finger brush?
So finger brush is a small silicone brush. Yeah, it is. There's a picture here. So it's a very soft silicone brush which has extremely soft bristles. So it can be started, the parents can start using it as soon as the first tooth is erupted into the oral cavity. Once the posterior teeth erupt, parents can switch on to the baby toothbrushes which are available in the market.
Another complaint is so toothpaste khatam doctor.
Toothpaste खातो म्हणजे the quantity of toothpaste is what matters. So ideally for 0 to 3 years, it is always recommended that a rice size or a smear layer of toothpaste is recommended. And once the child starts spitting, a green pea size toothpaste is advised. So even if that much amount of fluoride is ingested into the body, that is not going to cause fluorosis. So that is what is advised to the parents.
Thank you, Nupur.
We generally recommend below 2.5 year old kid. No, we generally recommend non-fluoridated toothpastes. So even if they eat, it's okay. If it is non-fluoridated toothpaste.
Okay.
There's one more thing. Parents ask which toothpaste is to be used.
Yeah.
There are so many brands in the market, but एक particularly toothpaste अशी काही there is not really required. Anything that has got less of fluoride content, it's good for child. And for the other adult patients, you can use the fluoride toothpaste.
Dr. Vishwas, the next question is to you. Genetic and metabolic disease. Can you shed some light on this?
Yes, many a times we get to see the patients with their deformities in their teeth. Some teeth are conical, some are pitted, some are discolored. All these various deformities which are seen are associated with the genetic and hereditary problems. So when these problems are there, we need to address the problem individually. Like if they have the conical teeth or pitted teeth, hypoplastic teeth, we can do a lot of things on those teeth. But if the child is having any systemic problem, that needs to be ruled out by referring the patient to the pediatrician or an endocrinologist, and then find out the deficiencies or the other problems associated with it, and then treat.
Enamel hypoplasia runs in families.
Yes, it does. And when you need to take the history of the parents, if the mother gets the child to the clinic and then sees that thing, you can check the mother's teeth also and then take the history and find out if the father or the brother or anybody, any other sibling has got that problem.
Another important thing that all of us are, getting to hear through conferences or through lectures is about tongue tie. So how important is this from the dental point of view, and which is the right time to address this, or what are the modalities that you have for the tongue tie?
Tongue tie is basically, in normal language, that inability of your tongue to move to its fullest potential. Now, what problem it pose is like sometimes when a child is old enough, he cannot clean, if he cannot put out his tongue to its fullest potential, he cannot clean all the corners with his tongue. Plus, there can be malocclusions, and the most important problem is while speech. So, once you come across these problems, you need to check for tongue tie, and as soon as possible, we need to correct it. Now, in case of newborns, when there is problem in latching or having milk, then we need to check for tongue tie. First of all, when the patient comes to us, a newborn comes to us, we try to send it to lactation consultant, and we try to make them understand latching or the method of latching might be incorrect. So we try on that first, and if it's still not happening, then we go for correction of tongue tie even in newborns as like 15-day old or a month old baby also, if there is big problem while feeding. Then after that, basically a tongue tie, there is a classification, a moderate, severe or simple tongue tie. From the tip of the tongue to the base of the attachment, it should be minimum 16 millimeter, like a 1.5 centimeter tongue should be free. If it is like only around 16 millimeter to 11 millimeter, then we call it as a very moderate tongue tie. If there is no problem in speech, we do not go for correction, we go for only speech therapy. If it is a moderate tongue tie from 11 millimeter to 8 millimeter, we still try to make them understand if he can speak nicely, there may not be a need of correction or a surgery. But below 8 millimeter to 3 millimeter, it is a severe tongue tie. We have to go for correction. Otherwise, he may not be able to speak.
And the modalities in one line, what are the modalities?
We can correct it with lasers, cautery, and it really takes hardly 1 minute, ma'am, nowadays with lasers.
Perfect.
No stitches, no bleeding, nothing.
Now, most important topic comes about the accidental injury to the teeth. Children fail while playing or while fighting or during the auto accidents, they avulse the tooth. So what message we have to give to the parents? What care to be taken? Can it be re-implanted there?
Yes, yes.
So
So the basic problem arises like portion of tooth is broken, or the most of the tooth is broken, or the tooth completely gets out of the socket. When it is a milk tooth, like before 6 or 7 years of age, if children fall, if child falls, and if it is a milk tooth, we do not try to replant immediately if it is absolutely required. And above that, generally around 9 or 10 years of age, if that is the permanent tooth, any kind of injury can be corrected. Even if he brings a broken tooth fragment, we can reattach that fragment immediately. Even the whole tooth has come out of the socket, it has fallen on the ground, please bring it to us. Sometimes, like most of the times, they generally call their pediatricians first because they are more attached to pediatricians. They don't, sometimes they may not have visited a dentist only in their life. So if some call comes to you, you can tell them, please find that tooth, whatever it is, and place it in saline or a normal water, or if possible, milk is the best medium to carry your avulsed tooth. So if you bring it to us in a milk or a normal saline, or if he does not find anything, he can just keep it inside his mouth. Saliva is the best medium to carry that. And if it comes to us within an hour, we can replant it, and the chances of that thing gets to get attached and survive is like more than 60 to 80%. Even if you bring it to us after a day, we still replant it so that replacement resorption occurs whenever we replant. That tooth might go after 4 or 5 years, but because of replacement resorption, bone gets filled there. And in future, we can have a nice bone to put screws like implants there, and we can restore his smile. So whatever happens, whatever fragment or the whole tooth, please bring it to us, we can reattach it.
But if it is within 1 hour, so 1 hour to reach to Pediatric dentist.
1 hour is the golden hour. If you bring, the chances are more. But even if you bring it after 1 day also, we can still replan it.
Okay.
We do root canals outside.
Okay.
And we reduce the chances of infection in that tooth. We can treat that tooth outside only and immediately put it inside.
Okay. Okay. What about the staining of the teeth, Chogole sir?
Yes.
What can be done or should be
Many
done or
of the-
should not be done?
Yes, many a times the children come to you basically with the black teeth or the stained teeth. And usually the reasons that are given is mainly because of the iron tonics that have been consumed by a child. But that is also, that is one of the reasons. But there are many other reasons which are got, these stains are extrinsic and intrinsic. The extrinsic ones are because of the external reasons. It could be because of the tonic, it could be because of poor oral hygiene, things like that. But sometimes when these stains remain permanently for a longer time, it's because of the intrinsic nature, because of the trauma, because of some consumption of systemic drugs. Now, when you have these kind of stains in the primary teeth, the treatment, if it is an external or extrinsic stain, you can do the polishing and probably put a crown or something like that. But bleaching per se is not recommended in primary teeth because of the anatomy and the morphology of the tooth. So, if you are considering the bleaching, it should be done only in the permanent teeth.
Perfect. Thank you, sir. The next question is to Omkar. What is malocclusion of teeth and how do you manage?
There are many reasons of malocclusion, as we discussed. Many times, children, parents, they don't know that at what age the tooth should fall. And early shading of any natural tooth, any primary tooth, may cause malocclusion because molars, milk molars, they should fall at around 11 or 12 years of age. Most of the times parents feel that molars, they don't even fall only. So this is a myth and they think the molar is not going to fall. So they tend to get carried away that it is not a milk tooth. Early shading of those milk tooth because of decay, as we discussed, falls or fights and losing 1 or 2 teeth, these are the common causes of malocclusion. Then there are genetic causes, like if it is present in mother or father, it can carry it to because of jaw sizes. And there are some syndromes where there is oligodontia, there are the number of teeth are less. So these are the common causes of malocclusion. Now the treatment modalities are basically if we start early or if we diagnose malocclusion early, there are many appliances which we can give, which are myofunctional appliances, which are based on your muscle movements, and we can correct malocclusion. Or if child comes at later stages, around 11 or 12, we can have, as everybody knows, braces. Braces are of many types, like there are steel, then there are ceramic braces, and nowadays the most in thing in our dentistry is aligners. But please, you need to understand that not all the cases can be corrected with aligners, and there are very false things going on in the market that non-dentists or non-doctors, they are also claiming and they are also providing aligners. Please don't fall for it. If somebody from somebody in your acquaintance, if they are going for somebody who is non-doctor and non-dentist and treating those with aligners, they might have problems in TMJ, or they might have they might get some other problems also.
Perfect. Now some rapid fire questions. Which is the first visit to the dentist? Nupur?
The first visit to the dentist should be as soon as the first tooth erupts into the oral cavity, but not later than the first birthday of the child. It can be the best birthday present which you can, the parent can give it to the children.
So that is the best tagline for today is when your child is a year old and comes to your OPD, I think we all should stress on the fact that their first dental checkup should be at first
At the
year.
first.
Yeah. So can you delay weaning in children with delayed dentition, Nupur?
No, we cannot because the Streptococcus mutans colonization in the mouth starts even before the first tooth erupts into the oral cavity. And also, if we delay weaning and the child is bottle fed, or if the child is, having any kind of pacifiers, it can lead to multiple malocclusions. So, weaning and delayed dentition per se do not have any correlation.
Perfect. So caries prevention treatment, Omkar, in one line.
Caries prevention should start actually, as it says, before caries start in your mouth. So there are fluoride applications, then there are pit and fissure sealants, which causes which makes the teeth less vulnerable to caries attacks. So these two are the things, and hygiene maintenance, obviously.
Perfect.
There is something called, was there any caries vaccine? There were not.
Sir, it is in very primary stages, and
Still in the primary stage. It was primary stages when I was a student.
yes, it is very difficult to control colonization inside your mouth, and there are more than 100 species which can colonize. So it is
Okay.
difficult.
Role of probiotics in dental hygiene.
It's a supplementary role. In children especially, there are no proven guidelines which say that probiotics can be caries or any periodontal disease prevention. So,
Another important thing, Dr. Chaugule, since your expertise in this field is humongous, treatment modalities for children with special needs.
Yes. These children, they have the problem with their morphology of the teeth, they have the problem with the gums, they have problem with the managing the caries. All these things are there. So when you see these kind of patients, usually the three lines of treatment: preventive care, the behavioral management, and the multidisciplinary support. These are the three main things which you should look for.
One small thing that you could tell our pediatrician friends is what kind of symbiosis can the pediatric dentist and the pediatricians have? Can we change our charts? Maybe we can add something in our, protocols, in our files. So what is the message that each one of you would like to give?
Yeah, certainly the pediatric, our friends, you people, you can tell that those, even if those teeth are primary teeth or the primary teeth, you must take care of it. So as soon as the teeth erupt, there should be a visit to the dentist. That should be a regular visit. That is the first thing.
secondly, if I can add, we can combine vaccination visits and regular pediatric dentist follow-ups so that when the child is coming to you for the regular vaccinations, we can do a screening there itself so that the parents do not have to wait for any pain or any kind of swelling, so that the treatments get more complicated in that. So we can just have early screenings and early diagnosis can be possible.
There are like 2 or 3 keywords. Like whenever a patient comes to you with a dental or orofacial pain, and when he says the pain is spontaneous, or he had pain throughout the night, or there is a small boil or abscess, it cannot be neglected. It has to be treated. We cannot just say that these are milk teeth, they will fall. Please. Thank you very much.
One thing I want to ask about, how many of you use nitrous in the OPDs and painless dentistry? How you manage the children?
We are very lucky that who introduced nitrous oxide sedation in India in dentistry. The person is present on the stage right now. He really deserves a big round of applause. Since last 40 years before, he brought nitrous oxide in dentistry in India. So he must talk.
Actually, nitrous oxide came through the dentist only first.
Yes.
I think Morton.
Thank you, Omkar, for that introduction. Well, nitrous oxide oxygen's inhalation sedation is one of the best methods to get rid of the fear of dentistry in children as well as in adult patients. It's very safe. Nothing can go really absurd with this conscious sedation technique. And this is so simple that even a dentist can do these things on his own. That is the very safest way of taking care of the anxiety of the patient.
Nothing to worry about any side effects or any.
No, there are no side effects because the machine itself has been designed in such a way that the level of the concentration of nitrous does not exceed 70%. So,
He himself has treated more than 10 to 20,000 cases under control.
yeah,
More than
then it's a very safe method of doing it. But remember one thing, that not each and every patient can be treated under conscious sedation. There are certain conditions wherein you will have to take the advantage of the general anesthesia in the presence of the trained general anesthetist while giving this treatment.
I think our panel has finished on time. I thank all the panelists for their precise and to the point answers. Thank you, Dr. Chaugule. Thank you, Nupur. Thank you, Omkar. And
Thank you,
I thank
Shilpa.
Dr. Anand Deshpande, my co-moderator. Thank you, audience, for that patient listening. I think with that, we will end our
Thank you so much, Shilpa Madam and Anand sir.
Hello. Thank you so much, sir. May I please request our moderators, Dr. Anand Deshpande sir and Dr. Shilpa ma'am, to please felicitate our panelists.
Round of applause.
त्यांचं नाव कट करू ना.
Thank you.